Welcome to this podcast from the Medical Journal of Australia. My name is Sam Hunt, the MJA's News and Online Editor. Today we are discussing what patients need to know about gastric and esophageal cancer. We'll look at what symptoms patients should look out for and the common diagnostic issues faced by general practitioners and their patients. This podcast is sponsored by the PanCare Foundation and funded by the Australian Government. The PanCare Foundation provides support to people impacted by a diagnosis of upper gastrointestinal cancer. The views expressed in this podcast do not necessarily represent the views of the PanCare Foundation. My special guests are Nick Verry and Dr Ralph Audehm. Nick Verry was diagnosed with esophageal cancer in April 2023, and he shares his story with us. And Dr Ralph Audehm is a general practitioner with 35 years' experience. He's led many initiatives in the management of diabetes, pre-diabetes, heart disease, and osteoporosis. Nick and Ralph, thank you both so much for joining me today.
Thank you, Sam. Wonderful to be here.
Thank you.
Nick, I'll begin with you. Thank you so much for being here to share your story with us today. Can I please ask about your cancer journey and how it unfolded?
So for me, it all started the end of January last year. I was actually away down in Coolangatta for my best mate's bucks party. We were at a place called Eddie's Grub House. I remember it quite well. It was a really nice burger joint there. I was eating a burger and it got stuck. I threw it up and that was the beginning of it. All that weekend, I was finding any sort of bread products, schnitzels and things like that. I was starting to throw them up. It'd feel like it was stuck and throw them up. So over the next month, I just changed my diet as any normal person would. I ignored the symptoms and I just went on to smaller foods, lighter foods, and figured I didn't have time to go and see a doctor. I had a friend's wedding coming up, had to do that. I had my son starting his first year of rugby, first year of school as a 5-year-old, had a 2-year-old daughter as well. So I just didn't have time to get it checked out. I thought it would just go away. I eventually saw a GP at the beginning of March after my friend's wedding. And at that time, I really downplayed my symptoms. I said, look, I was throwing up after a few meals, but I could avoid it by just having some noodles or soup instead. By that time, I had already lost 5 kilograms and my GP told me to get an endoscopy, but while we're at it, let's get a colonoscopy at the same time. So called with the local clinic. It was a 6-week wait to get that done. So look, I just let it happen, waited for the 6 weeks. So 2 weeks later, I came back from mowing the lawn, had a big scull of water, and I couldn't get the water down. I threw it up all over the floor, and that's when my wife put her foot down and made me go to hospital. So I turned up into emergency. I had an endoscopy the next day, and they found a massive food bolus at the bottom of my gastroesophageal junction. So at that time, they did biopsies, and that came back completely negative. So at that time, because I'd seen that the gastroesophageal junction had narrowed, I was diagnosed initially with a condition called achalasia, which I had never heard of. It's a 1 in 200,000 person type thing. And we're working on that diagnosis. So over that period of time, so over the next 4 weeks, I'd had CT scan, a manometry, which is one of the most horrendous things I've ever been through. Unfortunately, manometry didn't work. It just butterflied at the end of my gastroesophageal junction because there was no room for it to get through. And then I went for another endoscopy. It was actually the 20th of April last year, Thursday, the 20th of April last year. I went in expecting to have a Botox injection. So the treatment initially is Botox injections to allow the gastroesophageal junction to open up. Went in to have the Botox injections and came out woken up to be taken into a room by myself and told that I had esophageal cancer. I didn't get to keep the Botox either, which was disappointing for my wife. After that, things moved really quickly. I had an incredible gastroenterologist. So I had an incredible gastroenterologist who got me in touch with Dr. Andrew Barber, who's a fantastic gastric surgeon here in Brisbane. I had a PET scan on the following Monday, and I saw him the following Thursday because it was Anzac Day on the Tuesday. My gastroenterologist called me on the Tuesday, Anzac Day, to tell me it was adenocarcinoma of the gastroesophageal junction. I saw the surgeon and he reviewed the PET scan, went through. So I was diagnosed with stage 3 esophageal cancer. So it was in my esophagus, into my stomach a little bit, and then into, I believe, 2 lymph nodes at the time. From there, I started chemotherapy and radiation within, I think, a week and a half. First week of chemotherapy and radiation. So radiation was 5 days a week, 32 sessions over 5 weeks. And then chemotherapy was once a week for those 5 or 6 weeks. When I went in for my first lot of treatment, I'd already lost 15 kilos by the time I got to that point, because I didn't take it as seriously when I thought it was achalasia. I thought I was going to have this quick fix with the Botox. So look, I was on high protein shakes. Being an exercise physiologist, I know what I should be eating and how I should be able to do it. And so I was on a really high calorie shakes to maintain my weight. And I took it seriously once I found out it was cancer, and I was maintaining my weight. And then unfortunately my esophageal junction just narrowed to the extent where I could no longer swallow the shakes. So I was brought into emergency and had a nasogastric tube inserted endoscopically, because that was the only way to be fed. When I went in and had the nasogastric tube inserted, I woke up and my eyes were bleeding, my nose was bleeding because the pressure was so high. Because it was so tight, I couldn't actually swallow my own saliva past the nasogastric tube, because I've got some amazing photos of it. Obviously can't show it on a podcast, but it was that narrow that I couldn't swallow anything. So I was having to carry vomit bags around to be able to discharge my saliva. With that, I wasn't able to talk either. So talking generates more saliva. Turns out you swallow about 900 times a day, and I learned very quickly because I filled up a lot of bags of saliva at that time. I was in hospital for about 2 weeks communicating with writing on paper, and I asked many times if I could get a J tube instead, but my surgeon insisted because the plan was so I'd do the chemo radiation for 6 weeks, wait for 6 weeks, and then progress to an esophagectomy to have part of the stomach and part of the esophagus removed. So working on that, it requires the remainder of the stomach to be stretched up. And being only 34 at the time, my surgeon didn't want to compromise my internal organs by stretching them up and wanting it to last for another 50 years, hopefully. Maybe more than 50 years. We'll go to 90 or 100. So I couldn't have a J tube or an alternative plugged in. So I lived through an absolute nightmare it was about 6 weeks with the nasogastric tube. Throughout that period, it was learning to then use the tube feeding. So I had to start, because I was on no calories for quite a bit. I lost probably all up, I lost about 30 kilograms by the time I got to my surgery. So I was roughly 90 kilograms at the start of my journey. And I got down to about 60 just after my surgery. But during that period, look, I didn't like the tube because I was having to spit out all the time. So I eventually had the tube removed. The chemo radiation, I felt as though it was working. It wasn't until I had the histology report that it said that it wasn't successful, so to speak, but in that it didn't shrink the cancer itself. So I had my esophagectomy on the 18th of July, 2023. It was an incredible surgery, incredibly painful. And one of the things that I really wasn't prepared for is the phrenic nerve irritation. So the irritation in the shoulders and how much you don't have function with the shoulders. And I thought I'd had some kind of nerve damage at the time, but once I was educated a little bit more on it and the effects of it, came to understand it. Following that, I returned to work quite quickly. I had an amazing support with my workplace, and I was able to return within about 2 to 3 weeks, and mostly working from home. And I'm lucky in my role in that I support other people who are injured. And it wasn't until a few weeks later after that I reached out. I was speaking with an occupational therapist because I engaged a lot of my own providers, and I connected with Pancare. And from there, I was able to speak with others with esophageal cancer. So what was that? 18th of July, I had my surgery. I then have been on a journey of learning to live with the new normal. I started running quite a lot as soon as I could post surgery. I was running and back into my rehabilitation, so back in the gym. Then I got to January. It was the weekend of Australia Day, so 25th of January. I felt an incredible pain and just knew something wasn't right. Went into hospital again. I always go to my same hospital where I know my surgeon is. Went in and I had a hiatal hernia, which turns out is a small risk post esophagectomy because the stomach is so small now. So there's no stomach to block my colon from coming through my hiatal space there. So I had that. Then 8 weeks later, I was back into my running. So I started running again 4 weeks later because I'm aiming for a half marathon, which is the first weekend of June. On the 24th of March, I felt the pain again. I lifted my 6-year-old son and then went for a run, of course, as we do, and came back, and I had incredible pain again and ended up in hospital, and I'd re-herniated, and I had an emergency surgery to have that repaired. That one has now had my diaphragm stitched up, and my colon has now been stitched onto my diaphragm to hold it in place to hopefully prevent it from happening again. I'm being much smart about my recovery this time and not continuing to run. I am slowly graduating back into my running and realizing how much intra-abdominal pressure it does place when you are running. And here we are 4 weeks later.
Gosh, Nick, what a journey you've been through. Thank you so much for sharing it with us. Dr. Audehm, Ralph, you've been listening to Nick's story. And as a GP, how often are you seeing this kind of disease? And can you give me an overview of the risk factors for developing gastric and esophageal cancer?
Thankfully, we don't see esophageal or gastric cancer that commonly, but it certainly does exist, as we've seen with Nick. And unfortunately, yes, Nick got it very young because it is something that we see more commonly as people get older. And look, the risk factors, things like smoking, things like alcohol, spicy foods, long-standing reflux, other injuries to the esophagus. I mean, Nick, in fact, doesn't have any of those risk factors, and he has no family history. So, which just goes to show you that, in fact, you can't do everything just on risk. And the one thing, the big red flag that Nick had was his dysphagia. He had trouble swallowing. Food wasn't getting through. That's a red flag for any doctor, which is why we would then send, he needs to have a gastroscopy straight away.
And Dr. Audehm, when it comes to these kind of diseases, what are some diagnostic issues that GPs often face?
Unfortunately, I think in Nick's case, because he's so young, things like cancer wouldn't have been high on our radar. But again, the thing here was his dysphagia. He couldn't swallow. So that automatically tells us something was wrong and we needed to follow up. But of course, some of the people present can be a little bit more insidious. They may have a little bit of reflux that you treat, but it doesn't necessarily get much better. Or they have pain that you're not quite sure what's going on, and then you go further. So I think, in Nick's case, the dysphagia, the weight loss, that he needed to have something done. But for other people, I think the key thing is to actually review people to make sure that they do get better. So if we make a presumptive diagnosis, let's say it was reflux esophagitis, Well, over 6 weeks, I expect that to get completely better without treatment. If it doesn't, then you've got to start thinking, no, there is something else going on, and take it further.
And Nick, from a patient point of view, what was it like going to the GP with symptoms for the first time? Because you did end up with that misdiagnosis.
It was a case where, if anything, I downplayed my own symptoms. And I didn't feel like I needed to advocate for myself. I felt like my wife was advocating for me more than anything, because it's almost, we're too busy, and I didn't have time to have a medical diagnosis. I didn't have time to do anything for my own health. And I suppose my big message of it is for people as patients to prioritize our own health. And I think the more seriously our medical providers take it and force it onto patients themselves, then the better it is.
And Nick, let me ask you, how did your relationship with your GP evolve once you got this diagnosis?
Once I had the cancer diagnosis, I booked straight in with our family GP. My wife and my kids see the same GP, and I've always been sporadic in my visits. So I booked in with our family GP, and she was incredible. She organised so obviously GP referrals last a lot longer than specialist to specialist. So being able to organise my GP referrals, specialist referrals, she was able to organise all of my vaccinations. So I was, prior to starting chemo radiation, she gave me the flu jab and things like that to prepare me, gave me all the possible information to support throughout my journey. And she was always a phone call away, an email away. And the clinic themselves were incredible in supporting. And I have an amazing relationship with my GP now, in that I will always have a regular check-in, because there's always something happening in my journey at the moment. And I think that relationship is so important.
And Dr. Ralph, from your perspective as a GP, what's the importance of maintaining that relationship with the patient who's going through something so difficult throughout their journey?
Look, I think that's a great question, because people going through on this journey have never been through it before. Whereas as GPs, we have helped people in the past, so we can sometimes forewarn people what to expect. We can also, well, with Nick, it's a little bit different because he's so educated around wellness. But for a lot of our patients, it will be talking about nutrition, getting them active and keeping them active on their journey. Because, and I'm sure Nick will agree with this, that going through radiotherapy after the first few treatments, you do get really tired. It really does have a very big constitutional effect. So, supporting people through that, and then preparing them, for chemotherapy with things like immunization and advice around that. These are all great things. And then putting out fires as they develop. So when a new pain develops, is it abnormal? Is it normal? Sort of helping people work through that. But then supporting the family. I just can't imagine what your partner must be going through, because she's watching from the sidelines. And that's very hard for I think any person to see their loved one go through. But yeah, I think that constant relationship just helps keep ahead of some of the problems that may help or may happen, I should say.
And Dr. Audehm, what about the impact of chemotherapy and radiation on patients? Is this something you try and counsel your patients about?
People have never been through things like chemotherapy or radiotherapy, giving them a little bit of a heads up about what's coming, because it has such a huge impact on how they feel. And certainly if you're having an extended course of radiotherapy, the tiredness that they get towards the end. So I do pre-warn them that this is something that they're going to experience, and make sure that they've got the supports as they go through it.
And Nick, speaking as a patient, how did you find the impact of chemotherapy and radiation?
It was incredibly fatiguing. I went into it with a plan that I was going to continue my exercise and continue with my high protein shakes, and everything like that. But I was hospitalized pretty quickly in the piece and had the nasogastric tube. So it was compounded massively for myself in that I was getting minimal calories with the nasogastric tube through the days. I had very little energy in the first place, and that was compounded by the radiation and the chemotherapy. So whilst I was still fighting the symptoms, well, fatigue, cancer-related fatigue, exercise is one of the best things you can do for it. And I've known that going into my journey. So I kept on exercising as much as I could, but the fatigue was incredible. There was an example when I had come out of hospital and I was running around trying to take my son to the park and practice his football, and I went to try and run and my legs just didn't work. I fell flat on my face, and I think that's just a perfect example of what it feels like going through the fatigue of chemo and radiation.
And let me touch now on health literacy. Dr. Ralph Audehm, I'll ask you, what level of patient literacy are you seeing amongst your patients?
Of course, look, I mean, health literacy is something that's so variable, and it can be from someone who's highly literate, and really you're only there almost as a sideline support because they've taken control and they're really sort of working well with it. But then there are some people that you have to advocate the whole way through. I mean, that's just the nature of health. And within that, there are some issues. So, like, if someone's got the red flags of, dysphagia and weight loss, getting that timely gastroscopy is really important. This is where sometimes advocating for your patient is really important, because some of the public hospitals, if you're going public, they don't have private health cover, can't afford open access endoscopy. The wait can be months. You can't wait months. So if you've got someone like Nick and it's going to take 2 months to get your endoscopy, well, I think at that point in time, as an advocate, I would be phoning up the public hospital, talking directly to the surgeon or the registrar, saying, I've got a person I'm really worried about. They need an urgent endoscopy. Or if they can afford it, I would go straight to open access endoscopy, because I can usually get that within a week. It is expensive, but giving your person in front of you the choice. But I think advocating for them and not just waiting for the normal process is really important.
And now I'll go to you, Nick, a bit more of a personal question. It must have been an enormous shock being diagnosed and going through your cancer journey. Can I ask, how did you manage that psychological impact?
For me, being positive is such an asset throughout this sort of journey. You've always got to see the positive light at it and work towards the positive outcome at the end. What I've had to do is keep myself accountable and reach out to support. And so early on in the piece, I engaged an occupational therapist who was incredible in supporting through those times, and talking about acceptance and commitment therapy, and understanding that it is important to acknowledge these thoughts that, yes, you've got cancer. It is a terrible thing to be going through, but it is not a beneficial thing for me in my journey to worry about those thoughts, to let that consume you. And for me, exercise has been an incredible part of my journey, and setting those little goals throughout. It was the occupational therapist who then connected me with PanCare, and it wasn't until after I had my surgery that I found and discovered PanCare and the support that they have. The main thing I love joining is the monthly support groups. So I have monthly patient support groups with counsellors there, and being able to share your story and talk to other people going through what you have been through or have already been through it, and seeing people. I suppose the biggest benefit of that is you're talking to survivors.
And Dr. Audehm, how important is that wraparound care for people going through cancer, care and attention not just from the GP but from an OT and support groups?
Look, I think that sort of support is critical to keeping people well. I think, a lot of the hospitals have realised now that doing the procedure, removing the cancer is only part of the journey. There is a whole lot of follow-up that goes, and that personal wellness, that mental wellness, that physical wellness, that eating healthily, becoming active again, actually improves survival. And we're starting to see now a lot of survivorship programs where people post-cancer will now go to these sorts of programs to really, turn their life around, get them healthy, feeling active again. And certainly in Nick's case, he would have lost so much muscle. I just can't imagine what he would have lost. It's going to take him a while to get that back and feel well again, I imagine. Great idea, though, going for the half marathon. Hope you do well.
I've been responsible about it, and I've dropped down to the 10 kilometres now.
Yes, Nick, we wish you all the best, and thank you again for being so candid in sharing your journey with us today.
Thank you so much for having us.
And Dr. Audehm, thank you as well.
Yes, thank you very much.
My special guests have been Nick Verry and Dr. Ralph Audehm. Nick Verry was diagnosed with esophageal cancer in April 2023, and he's shared his journey with us today. And Dr. Ralph Audehm is a general practitioner with 35 years' experience. This podcast is sponsored by the PanCare Foundation and funded by the Australian Government. The PanCare Foundation provides support to people impacted by a diagnosis of upper gastrointestinal cancer. The views expressed in this podcast do not necessarily represent the views of the PanCare Foundation. You can find more podcasts from the Medical Journal of Australia on our website at mja.com.au or wherever you get your podcasts. Thank you so much for listening.